Good afternoon to one and all present here. Myself, Dr. Alopi from IAP Digital Media Team. I will be the host for the today's webinar on exercise as a medicine for a aging platform with the resource person Dr. K.C. Gayatri ma'am, being organized by IAP Women's Cell Tamil Nadu team on the occasion of the World Physiotherapy Day celebration. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP Digital Media team consists of the group of physios who handle the Zoom platform, webinar, live streaming, and IAP profiles on a social media platform like a Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow IAP profile on this social media to receive notification for our events such as webinar, workshop, CMEs, conference, health camps, blood donation drive, and to know about the recent updates on a physiotherapy. Subscribe to IAP YouTube channel for the notification of our live webinars. In a playlist section of this channel, webinars are segregated into a various folders on the topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary women's health, research, cancer rehab, etc. for the easy access. The social media link will be shared in the chat group shortly. Without wasting much more time, now I would like to hand over this session to our today's moderator, Dr. Divya Bharti ma'am. Hand over to you, ma'am. Thank you.
Thank you. Good afternoon to one and all here. I am Dr. Divya Bharati. I am here to introduce our Honorable Speaker Dr. Gayatri. It gives me a great pleasure to introduce Dr. Gayatri ma'am, MPT in Neurology and MA in Sociology and PhD, a distinguished physiotherapist and academician with over 16 years of expertise in neuro and pediatric rehabilitation, early intervention, curriculum design and research. She is currently serving as the Dean in charge at the Chettinad School of Physiotherapy, where she also contributed as an associate professor since 2021. Dr. Gayatri ma'am holds a PhD in pediatrics from Chettinad Academy of Research and Education, alongside her masters in physiotherapy, neurology, and sociology. Her career spans diverse roles from development therapist at Madras Medical Mission Hospital to pediatric rehabilitation specialist and academic leader. A recipient of prestigious awards including Young Researcher, Best Teacher, Excelled Accommodation, and Best Paper at ICROM 2023. Dr. Gayatri ma'am has made significant contribution to the field with over 15 publications, 3 book chapters, and 2 patents. She is also a certified Bailey practitioner and a licensed MIAP physiotherapist. Beyond her research and clinical work, she has played a pivotal role in academic leadership as Care2C convener and the organizer of Chet Physicon. With her blend of clinical expertise, research excellence, and academic leadership, Dr. Gayatri ma'am continue to inspire the physiotherapy community through her dedication and vision. With her vast experience in academic and clinical practice, Dr. Gayatri ma'am will share valuable insights on exercise as medicine for the aging population. Let's welcome Dr. K.C. Gayatri ma'am and hear her thoughts on this important topic. Then my humble request to participants to post your questions in chat box. At the end of the session, we will discuss about this. Dr. Gayatri ma'am, kindly go ahead ma'am.
Good afternoon to one and all. Is it audible to you all?
Yes ma'am, it's audible ma'am.
Yes. I deeply honored to be here today as the part of World Physiotherapy Day 2025 celebration organized by the Indian Association of Physiotherapy Women's Cell, Tamil Nadu. And my sincere thanks to Dr. K. Pradeepa ma'am, the State Joint Coordinator, and the entire IAPWC team for inviting me to share my insight. I would also to extend my gratitude to our mentors, Dr. Sanjeev sir and Dr. Ruchi ma'am and Dr. MC Mercy ma'am for this opportunity. And I also like to thank for giving me this to share the knowledge. Um, and I take this opportunity to wish you a very happy Teachers Day. To today's a Teachers Day. I wish to the soul. Shall we go on with the sessions?
Yes, ma'am.
Sure. My screen is visible to you. Is it visible to you?
Yes, ma'am. Now it's visible, ma'am.
Okay, okay, sure. Today we are going to see the topic as exercise as medicine for aging people. In this, we can say that aging is an uncontrollable process. So we want to take exercise as a medicine. Mostly the geriatric patients will have their medicines in their aging process, even though they have for medicines as a diabetologist or for the thyroid or any problem, they will take BP tablets or like that. But we want to keep exercise as one of the medicine, and it will be the most important medicine also for them. That is going to be the topic for myself. And according to the entire Dr. Robert, if exercise could be a packed into a pill, it would be the single most widely prescribed and beneficial medicine in history. Most of the people they will think that if they want to get rectified means if they are taking any pill, they will relax them. If they are having any comorbidity disease or anything else, they think that if we take the tablets, it will give relax. They will have so much of struggles to do the exercise. They are not thinking that we want to go on with this medications like that. So with our topic, so exercise is very mandatory, and exercise is one of the best medicines for curing of all the diseases. So exercise is a celebration of what our body can do, not a punishment for what you eat. Actually, we will have so much of junk food and we will hate our body, and we will keep on punishing our body. So exercise should, we want to take care of our body. If our soul is good means we can have a very healthy life. So exercise is very, very important. That is, we are going to see that. Next, exercise is like the body's natural medicine. It keeps the heart strong, bones healthy, muscles active, and a happy mind. Nowadays, the people are so much of stress and having depressions and leads to psychosomatic disorders also. So exercise helps in reducing of the stress factors. So exercise not only helps only have the very build up to body structures, it helps to have a happy minded also. Just like a daily dosage of the vitamins, regular movements helps prevent diseases, reduces stress, and add energy to the life, making us healthier, stronger, and younger at heart. So most of them will think they want to be young. If we are having any pills, it won't help us to be look like as a young. But if we done the exercises, it will help a lot. If you are at the 50, 60, or 70 years also, if you are doing the exercise as a regular pattern, you can feel it as a young looking that. Next, what is aging? Aging, yes, of course, it is a, we can't stop the aging. It has been started with, it will go on there. So aging, it's a non-stoppable. So aging is the natural time-dependent deteriorations of the physiological functions that leads to a decline in the organism's ability to adapt and survive, ultimately which increases the vulnerability of to disease and the death. It's a complex biological process characterized by the gradual accumulation of cellular and molecular changes, which resulting in the senselessness, which is the loss of your cellular and organismal integrity over time. If it's getting more than ages of 60 years or 70 years, it will look like you are look like I say 80 to 90 years. Because of you're not doing exercises, the muscle power won't be there, so you will, your faces will looking because of that. Then the diversity seen in the older age is not random. Beyond biological changes, aging is often associated with other life transitions such as retirement, relocation to the more appropriate housing, and the death of the friends and the partners. So aging is the nature, but how we age is in our hands. So what you're having today, if you're having so much of exercise, and the exercise will helps you to lead your life in a very good manner. So the secret to staying youthful and active lies in the way we eat. So what we are eating today, it will result on your tomorrow, and it nourish and move our bodies. We should not have, most of them we are having sedentary lifestyles nowadays. So we want to keep our body to be moved, so it will help to have the younger ages. Healthy food fuels our cells. Balanced nutrition protects our organs, and regular exercise keeps us strong. Together, they slow down aging. So, not only the exercises, exercise plays a very major role, but we want to have a healthy food, balanced diet. It also helps for the geriatric persons to lead a normal life without any disease. Most of the geriatric peoples, it's a second childhood shift. They have so much of independence, and they will, some people will have the dependency to the others, avoid their dependency, and they want to have their independent life. This exercise is very important to lead their life as a independence. So together, which the food and the exercises, they slow down the aging process, which helps to prevent diseases and add not just years to the life, but life to the years. This word will give you this meaning of not a years to the life, but you will give life to the years. You want to live, but it should be a healthy manner. So age is just a number. When you feed your body with goodness and keep it moving with joy. If you have so much of joy, it will help you that. Nutritious food nourishes the soul, exercise strengthens the spirit, and together they are the natural magic recipes to stay youthful, vibrant, and full of life at every stages. The prevalence of the global aging is increasing dramatically. The portions of the world's populations aged 60 years and over is projected to rise from the 12% in 2015, and it has been increased to by the year of 2050 it is increased to 22%. Nearly you can see that it's doubling of the numbers to the 2.1 billions of the people. By the year of 2030 it can be estimate that one in the six people worldwide will be the 60 years of the ages of 60 years and older, and 2050 80% of the older people will be living in the low and middle income countries. This significant dramatic demographically shift driven by decreasing fertility and increasing life expectancy present both challenges and opportunities, including increased demand for healthcare and social system to support older adults and to raise the age related disease. Aging, same, it's a natural process which include both psychological, physiological, and functional changes. So age related factors will be there which affects like our bones affected cardiovascular changes. So mostly we will have so much of changes in the bone. If it reduced in the density, we can see it as the osteoporosis. If it affects in our cardio, it will result in the cardiovascular declines, and in the cognitive, some people will have dementias. So cognitive impairment will be there. As in, the patient will have decreased in the balances, and this all results in the reduce of the quality of the life. So exercise is now considered a non-pharmacological medicine to prevent, delay, or manage age-related condition. If the person is 60 years or 80 years, they will be dependent on pharmacology. If they're doing exercises from the younger ages itself, from the 30 years itself, they can be lead a life without the medications. They can do that. According to the WHO, has launched the decade of the healthy aging, that is the 2020 to 2030, to foster collaborations among the governments, civil societies, and other stakeholders to improve the lives of the older people. So this year they were concentrating on the older peoples to improve that. So most of them hormonal changes is also one of the factors in the males during the aging. Aging in the males involves androgenesis, a gradual decline in the testosterone. Hello.
Gayatri, sorry to interrupt you, ma'am. So
Yes.
could you please put it in slideshow, ma'am, because it is more visible.
1 second.
Yes, ma'am.
Ma'am, second option from current slide.
1 second, 1 second. Is it okay?
Yes, ma'am. Now it's
Yes,
okay,
ma'am.
ma'am.
Thank you.
Oh,
Thank you, ma'am. Thank you.
Hormonal changes in the males, they can have changes in their musculoskeletal health, sexual functions, mood, cognition, metabolism, immunity, and sleep disturbance will also plays a major role in the geriatric population. So sleep is very important. If the sleep disturbance, it will also affect their normal life. For the females, menopause will be the very challenging for them. Menopause make the females to have most of the mood swings. So women will undergo this menopause. So most significant hormonal changes will happen to them due to the declines in the estrogens, progesterones, and the androgens, which is affects their bony prominence and the cardiovascular system. Most of the women in that age, they will have so much of psychological feel, and in the aging they will have who will take care of them. This of the hormones imbalance also, they will feel that. So you can see that in this elderly ages, most of them back stays, they won't stay with their kids. So most of them, they want to have a enjoyment with their parenthood, or they want to have their healthy relationship with their spouses. Most of them, they will say we are aged, so we should not have this much of time, we won't have time to spend anywhere else. So if they are having like that, they are not spending time to them, they will have the we are ages, and that will psychologically depress, and it will also lead to them. So they can have any one of the habits, like they can spend with their pets, or exercises, yoga, or having anything else to keep their mind very happily. That happily will help to lead to their normal life. So these are the popular personalities. We can't guess them. They are having this much of age. Can you see that Rihanna is 86 years. If they are exercising, they are looking like as the 60 years. And the Jennifer Lopez is 56 years. Due to proper exercises, they are looking like this. Now also from the 1960s to 2024, she is looking like this. And now you can see the Charuk, he is still, we can see in this children due to this exercises, they are resembling that. This are the, because we are keeping it as, if they are doing the exercises properly, still we can see how they entered into the field. If you are properly exercising, so exercise will help you to maintain the same in what age you are also. Next, for factors which are determining aging. In this, that genetic is one of the factors which tell to the family life of longevity and the genetic mutations. And natural passages of the time, that is your chronological ages, and sex and genders, hormonal profiles which differs in their lifespans. Most of the women will live longer than the males due to some of the genetical system. Next is your intensity. Certain population have genetical predisposition for disease and the longevity. Next, very important, what are the modifiable factors we can go on with to have a healthy life? In this, nutrition plays a very important role. Aged people, we want to take balanced diet. If they are having any comorbid disease also, they want to have the balanced diet, accidental and reduced processed food. And our role was exercise and physical activities, improves mobility, reduce chronic disease, and enhance brain health. So they want to have any puzzles gaming or task oriented activities. They can have some kinds of physical activities which keeps them very active, which helps to them to think as we are not 60s, we will think it as a 40. We won't tell that don't use this bike, you are already aged. So they will think if we are using normal exercises, we can use that also. So exercise is very important for low leading tasks. Next, sleep is very important. Aged people mostly they have this. So adequate of sleep is very important. While good quality rest supports repair and regeneration, and stress management is very important. They think that we are already geriatric condition. We are some people will won't discuss with their family members. They will separate them and they will take their decision as it would. It will affect them. Oh, we are old. That's why they are not discussing with that. So they will have this type of, so isolation will leads to the stress level, and stress management is also very important for the geriatric patient. The stress management they can go on with the mindfulness, yoga, meditations, and the relaxations. This will help in the reducing of the adhosteroids and the inflammatives. And most of them will have habits like aged persons to their companions. They will go on with the smoking and then alcohol as they occasionally. If they are avoiding that also, it will help to live their normal life. Next, the physiological and the social factors, which is very important. Most of the people, if they are mentally strong, if they are keeping mentally healthy, it will help them. If your mind is fit, your body will be fit. If you're mindly, you are upset or something else, it will result in your healthy soul. So, mind health, mental health is very important. In this mental health, you want to concentrate on the positive mindset. As soon as in the geriatric patient, if you are having any problem, also you will think we are going to die or we are not able to fit for this, we are not able to walk this time, like that. So positive mindset is very important. We can do it. How long we have traveled, so we can take this to the next level. So that type of positive mindset should be there. Next is here reduce depression and anxiety. Aged people will have so much of depression due to the children or anything else. So depression should be reduced, and anxiety, what will happen next to that? It should be reduced. Next is here cognitive stimulations. This cognitive stimulation hobbies is very important. Mental exercises. In this, most of them will say exercises. Mostly they will go on with the physical exercises. They will go on with the aerobic exercises or resistance exercises. They will concentrate on the physical exercises is very important. Comparatively cognitive stimulation of the mental exercises. If your mental is very fit, you can say yes, I'm fit. If your mental is unstable or it's not at first, you can say, you will say that you will feel it as a very weaker. So mental exercises like anything, relaxations, playing puzzles, you can play with your grandchildren. So it will help you. If you are being with a age below than you, if you are 60, if you are speaking with the 40 years or 30 years, you will think that you are also same to that. So mental exercises, hobbies, and lifelong learning process. So we are 60, so I have learned a lot. You should not think like that. If we are keep on learning, life is very long process, and every day we can learn anything from anyone else. Whoever we are meeting, there will be a teacher for them, so you can learn from them. So lifelong learning, still we want to learn that. This type of cognitive stimulation will help you to lead a normal life. Next is the social engagement. In this, most of them will isolate that. So for that, you want to have the family members, community, and the peer interaction. Mostly you can see that aged person will go for a walking in the morning. They will go for walking, not only for the walking, for the physical. They will have the same aged people to interact, and they will relax themselves. They will have fun with them. So that type of peer interactions is very important to lead the social engagement to have that. Next is your medical and physiological effects. In this chronic diseases, most of them, majority of them nowadays, 40 years itself, they are suffering with the diabetes and the hypertension. It can lead to the cardiovascular diseases. So mostly the stress which leads to the diabetes and the hypertension. So it should be managed by our factors. Next is your hormonal and the metabolic regulations, lifestyles and the medical interventions to maintain our balances, regular health screening. So yearly detection and treatment of the age-related conditions. So if you are 60, just go on with the yearly checkup for yourself and keep yourself fit. Yes, I'm fit for this. So you can see this exercise, mobility, and independence. It will comes to prevent the health diseases, and it will helps to manage your stress, which will results in the reduce of the corticosteroid hormones and the resilience better mood, and which increases your good sleep. And exercises which helps in the nutritional cell repair, which helps to live for the longevity, and exercises will help you for the healthy aging to improve your quality of life. Quality of life means your independence to lead your daily activities that will result on your quality of life. And these are the nutritional factors and the food for the healthy aging. Protein is very important for the peoples, and then for the carbs, we want to eat a full plates with the whole grains, fruits, vegetables, which helps in the bowel and bladder control, bowel regulation, and the blood sugar levels. Fats is very important. If they are not having proper fats, also it will affect their body. So, unsaturated fats like olive oil, nuts, seeds, fatty fish, which helps to have a good fat for that. Omega 3, which is very important for the 80% for the cognitive health and the anti-inflammatory heart protections. Micronutrients lacks calcium and vitamin D is very important, which helps to have a bone health, osteoporosis prevention. 60 years, most of the people will have sternal osteoporosis. To prevent this, so calcium and the vitamin D exposures is important. Most of them we are working in this field, so we are not exposing to the sunlight. Some people will have so much of in the hospital itself, they are working, most of them are exposing only to the AC related. In this AC, so if you are taking prevalence of how many vitamin D deficiency means out of 10, 7 to 8 people will have the vitamin deficiency. So we want to take care of that. And vitamin B12, which is very important for your nerve function, and it helps to prevent your anemia. And vitamin B6 and folate, that is your cognitive functions and the cardiovascular protections. Antitoxins like vitamin C, E, selenium, and zinc, which helps to reduces the oxidative stress and aging related cell damage. You can see that some people will have skin is very striking, not having proper skins due to this. They want to have a proper vitamin C and the E. It helps to have that age related cell damages, and they will look like ants due to this. And iron is very important, which helps prevent anemia, but excess may cause complication. There will be that. And the magnesium and potassium, which helps in your blood pressure control and the muscle functions. Water, most of them adults will take water, and in the older adults they won't have water properly. Some people will say I'm having diabetes, so I won't have proper water. If you are exercises also, so water intake, you want to keep your body hydrated. If it becomes dehydrated, it will result of the minimum of at least 2 liters is taken. 2 to 3 liters is mandatory. If the patient is affected with any other, so 1-2 liters it should be that. And dietary parts for the healthy ages, some peoples will focus on the DASH diet and the plant-based diet, high protein diets, and the Mediterranean diets. Mostly diets is important to concentrate on the vegetables. And we can go on with the osteoporosis. So Ryan, we can go the osteoporosis. So calcium and vitamin D is very important. In this, we should go on with the weight bearing exercises. In this weight bearing exercises, we can start without the whole own body weight as the first stage. If the patient is can't able to stand, we can help the patient to stand with the help of their own body with anything else. If the patient is having osteoporosis, they will have changes in their bony prominence. So we will start with the exercises like this. If they have sarcopenia, high quality proteins and the resistant exercises. So resistant exercises, first we want to go with the normal weight dumbbells or weight cages, which helps to improve their muscle power and helps to withdraw from the sarcopenia. Next is your cardiovascular disease. In this cardiovascular disease, we have a separate cardio exercises. In this cardio exercises and the aerobic exercises, which is open cardiovascular, which helps. We minimum exercises like walking is a very good exercises, and the jogging is a normal cardiac exercise. If the patient can't do anything else, also at least exercise like walking or jogging, which helps that. For diabetes, it's nowadays most of the people are in this, so it should be banned by using of the avoid refined sugars. Next is your cognitive. For this, vitamins is important. Um, Practical dietary for the healthy aging. Most people won't say, I won't want food, so I'm going to diet. I don't want to have that, so I will cut the food. So if you are cutting the food, it won't help you to recover from the diabetes. So you want to change this, eat small, frequent meals to improve digestions and include colored vegetables and the fruit. Stay hydrated, limit processed food, encourage social means to improve appetite to reduce isolations. Mm, then dental problem difficulty. So most of the people will have dental decay. So we can give the exercise. If you are giving exercise for the oral exercises, they won't do that. But instead of giving oral exercises, if you are giving the patient acid chewing activities or balloon blowing exercises or introducing straw to have that, it will helps to improve their oral activities. It will help in to reduce of the dental problems. Next is your limited mobility, difficulty in the shopping or cookings. We want to encourage them to actively participate in the home day. Role of health professions in this, as a physiotherapist, we want to integrate exercises with the nutrition advice for the bone health, and the dietitian and the nutrition assess dietary intake, how much they want to take and how long they want to take. It will comes with the dietitian and the nutrition, and the doctors, they will screen for the any malnutrition. So most all the health professional will have their individual role. In this individual role, physio, as a physio, we want to give proper exercise to the patients, which helps to have their aging as a very joyful. They should not have it as a burden. Stress is a biopsychosocial phenomenon which impact the physical and mental health. With the aging, stress can worsen age-related diseases such as hypertension, cardiovascular diseases, diabetes, cognitive decline, and depressions. So, if we have so much of stress, or we want to improve, then the stress management is very important. By live for living longevity, independency, and the improved quality of life, we want to have the stress management. So exercise plays a very good role in the stress management role. Impact of the stress on the aging. So chronic stress, if you have so much of stress in and the physiological aspect, it leads to the prolonged cortisol release and the accelerated cellular aging, impaired immune system, and the psychological effects like this, and the functional deficits also will have that, which results in the social withdrawal. They won't involve in the social activity. They will start to isolate themselves from that. And these are the evidence-based stress management strategies. So exercise under the physical activity, under the exercises, aerobic exercise, it's very good. There is evidence shows that aerobic exercise will helps to reduce the cortisol and which encourage the mood, improve the cardiovascular health. And the resistance training is very good to improve the resilience of the stress and counters the sarcopenia. And Tai Chi and yoga, which also helps to lower the stress level, improve balance, and to improve the sleep quality. Next is your mind body intervention. In this mind body interventions, um, improves emotional regulation and reduces anxiety and the depressions. So most of them will take medications to reduce their depression. If you are doing proper mind relaxation exercises, it will help you to relax from the most. Nowadays the students will also have, they will go on with the relaxation techniques to have their proper lifestyles. Deep breathing, actually deep breathing exercise will give you a very good very good effects in the abdominal relaxation techniques to have the proper life. Next is your CBT. Nowadays, cognitive behavior therapy will helps to reframe the stresses to improve coping strategy. We can see it on the hormones on the 2012 in the systemic review. So resilience technique, it's one of the technique which helps to encourages your adaptive coping and acceptance and problem solving. So acceptance is very important nowadays. Most of them were not having the acceptance states. Social support and encouragement. Strong social networks reduces loneliness and the better coping. Most in the geriatric patients, not a patients actually, in the geriatric populations, they will want to have the so much of peer group minglings, and the family support is very important, and the family support will helps to reduce the loneliness. If they are socially engagements, they will have a better healthy life. So community programs, volunteering, they can encourage them to have the group exercises. Next is here nutrition and sleep, anti-inflammatory diets which helps to reduces the stress level, and adequate protein, and reduces the corticosteroids which helps in the good sleep hygiene. Next, we can go with the music therapy is there, and the massages, which will helps in the aging people to relax for this. Barriers for the stress management in older adults. As soon as they get retired from this job, from tomorrow onwards, they are not having job. That time they will have so much of stress. How we are going to do that? In that part, if they are going with the exercise, it will help to know that. So limited access to the structured programs and physical limitations which helps them. Next, lack of awareness and the motivation. Next is your social isolations and financial constraints. These are the most of them. Now we can go on with the exercises. So exercise is often called the most powerful medicines. Now, initially, which we said, like that exercise, if you are giving the exercise as a pill means, they will take that pill and they feel that okay, within 3 to 6 hours it will work. So exercise should be a pill for the permanent. So pill will give you results for certain times. If you're doing the exercise, which helps you to have a longevity and helpful to lead the normal lives. And these are the exercises benefit, physiological benefits of the exercises, which improves the bone density to improve that, which improves flexibility and the and in the cardio system, we can see the blood pressure reducing, resulting in the heart rates, which includes that low risks of the coronary artery diseases. In neuro, it's very important. It helps for the neuroplasticity and memory. Most of the people in the age, they will think that they have been forgotten something else. They don't know. They think that I have kept my bike key or anything, or they will mostly search for this phone. They said that I have kept it here, but they will have forgotten that if you are training your brain by giving any mental exercises, it will helps to improve your neuroplasticity, which has been already taught. It will improve you, and the memory also it will increases. Next is your delay onset of the dementia. Dementia is the how much of they are forgetting that. If you are practicing any puzzle games or if you are engaging in any activities, mostly geriatric population, please encourage any one of the task oriented activities, puzzle games. So game is very gaming therapy, it's there. So if you are playing any game, it will help you to improve your memory power and it will help you to enhance your neuroplasticity, which will decreases your dementia and the Alzheimer's disease. And it also improves your mood good to be a good and which reduces your depression levels. It helps to prevent from the falls. Mostly, it leads to independence the daily activities. And so the exercises, mostly we can go on with the endurance training and the aerobic exercises. In this aerobic exercise, basic of at least walking we can go or cycling or swimming. We can give in a week 150 minutes of moderate intensity is advisable for the population. And for if we are going with the resistant training, most of the people will go on with the body weight exercises. If we want to do resistant training, most of them think okay, we want to go to the gym and we want to do a workouts like that. So going to the gym and doing the workout is different. We can start in our home with the basic resistance like resistant bands or dumbbells. Then we can go with the weightlifting exercises. That to 2 to 3 times a week for concentrating of the muscles. Flexible training is important. In this flexible training, yoga and stretching. So stretching is very important, which helps you to have the flexibility in your muscles. If you want to have normal joint range of motion, so stretching plays a very good role in this. So coordination exercises. Mostly what we think is we want to go with the gym and we want to have so much of, but basic single leg stance itself will help you to have the normal balances, and the functional task will help you to have the normal things, which reduces if you are single doing single stand, that time your whole body weight will shift on that leg. So it will improve your concentration, it will improve your leg muscle powers. So if you're doing any exercises, the sensations works on it and it will lead to have a proper life, which things. And exercise prescription for the older adults, that is your fit principles. In this fit principles, frequency, intensities, time, and what type of exercises we can give. So usually we will advise the geriatric population like 3 to 5 days a week they want to go on with the aerobic exercises, and then 2 to 3 days in a week for the strength training exercises. In the strength training exercises, we can have the intensity, how much of intensity we can give. We can't give for 80 kgs man and the 60 kgs man the same exercises. There should be changes in this. That is your intensity will change. For this, the moderate of 40 to 60 percentage of the VO2 max, that should be calculated. So cardiac levels, how they are affected and how we can go on with it. Exercise is we want to prescribe individual to individual. It was varies. We can't give a group therapy. Yes, we can go on with, but there should be any changes and there will be a priority to someone else to how they can go on with that. Next is your timing slot. In this timing slot, 30 to 60 minutes, a session should be there. In this timing slot also, we want to have the combination of the aerobic exercises, resistance exercises, and the flexibility and also the balance training. Next in the clinical evidence. So regular physical activities reduces all-cause mortality out by 23%. If the people is having any problem in this, if they are going a regular exercises, 20% of them they will have that. And then exercises decrease disability and dependency in aging population according to the Fleming studies. They will say that. According to the WHO guidance, exercise is a key strategy in the healthy aging 2030. If we are doing proper exercises, we can lead to that. Barriers or most of them will say that fear of falls or injury, chronic pain. I can't go this, I can't do this exercise. I'm already aged. So psychologically, they will have that, and lack of motivation plays a very important role. Most of them will say you're already 65, you are going to do. So lack of motivations and the social support, it also plays a barrier to the people. Role of physiotherapist. So Physiotherapists, as we are physiotherapists, we want to have a individualized assessment. First, we want to start from our family members. We want to go with the assessment for our family members, our fathers or our mothers, how they are, and we want to give proper assessment and exercise prescription to them. If we start from our home, then we can go with them. Mostly, we will concentrate on our patients, not to our family members. If you are concentrating there, it will play a major role. Next is your monitoring of the safety and progressions. If we are giving same exercise for the 1 week, 2 weeks, they will feel that, oh, this is only we are going to do. So they will feel bored on that. It should be changed, and we want to have a modification in that exercises. Next is your education and motivation to decrease awareness. Next, incorporating community and the group programs. Mostly in the community based, you can see most of them will have the evening, they have group exercises, chit chats like that. They will have fun, and it will improve their healthy life. So now we can come to the conclusions of that. Nutritions provide essential fuels for your cells, tissues, and organ system. Balanced diet slows biological aging and prevents age-related disease. Stress accelerates biological and psychological aging, but it is a modifiable cause. Exercise functions as a safe, cost-effective, and powerful medicine for aging individual when prescribed and monitored properly. It not only prevents diseases but also promotes independence, psychological well-being, and healthy longevity. Evidence we have strongly supports for the exercise, mindfulness, CBT, cognitive behaviors, nutrition, and social support as effective interventions. Multidisciplinary approach is crucial and promoting healthy, successful, and independent aging. So thank you all. Any queries?
Yes, ma'am. Thank you so much for your wonderful presentation, ma'am. Just only one query, ma'am. How the cognitive behavioral therapy works on geriatric population, ma'am? Could you please explain, ma'am?
Cognitive behavior therapy, we want to go to their age, and we will tell them mostly empathy works here. So we will tell them, they will think that I am suffering a lot. We want to think in that place, and it acts as a empathically. If you are giving the treatment, it will help for them.
Okay, ma'am. Thank you so much for your explanation, ma'am.
Thank you.
That's all, ma'am.
Thank you for giving me this opportunity. So my now try to start your a healthy aging from your family. Thank you.
Thank you, ma'am. Oh, one minute, ma'am. Dr. Gayatri, ma'am, we would like to extend our heartfelt appreciation for your thought-provoking presentation on exercises as medicine for the aging population. Each and every slide is very clear and knowledgeable and in a practical and evidence-based. It should inspire our whole physiotherapy community. To our participants, thank you for your active engagement and thoughtful questions. Your enthusiasm and interest in the topic made the webinar truly interactive and engaging. To the organizing team, thank you for your tireless efforts in coordinating this webinar and ensuring its smooth execution. As we conclude this webinar, we hope that knowledge and takeaways from today's session will inspire you to prioritize exercises and physiotherapy in promoting healthy aging. We look forward to hosting more such informative webinar in the future. Thank you once again and wish you all a wonderful day. Thank you so much, ma'am, for your valuable time.
Thank you so much.
Thank you.